Hi everyone, Chris and Aaron with Perfect Postures, and we're going to show you a couple corrective exercises. These exercises are designed to address a elevated pelvis, and we just talked about that with the Ask Aaron, and that's more about the leg length disparity. So first thing we're going to do is have Chris in a we call it neutral back. So his legs are up over, it could be a chair, ottoman, couch, bed, but basically you want to try to be as close to 90 degrees as you can. That's going to help neutralize the muscles around the pelvis and the low back. So Chris's arms are in a goalpost position. He's going to slide one arm along the floor. He's going to reach up as high as he could. Even if the elbow comes off the floor a little bit, that's okay. Try to get the stretch through the whole lateral portion of your torso. You want to stretch. You want to hold that for about 2 seconds. Really reach up, reach up, reach up. Get that stretch, come down, switch sides. And you want to do that about 10 times on each side. And that should be good there. So what we're going after there is one of the muscles that typically gets affected because of its attachment points is your lat muscle. It's called your latissimus dorsi. And that muscle attaches into your arm, your armpit really, and it travels all the way down and blends into the low back. So we're trying to elongate that muscle in that soft tissue area, and that's one way of doing it. You're going to contract on one side, you're going to get a stretch on this side, and then vice versa. So not only is the lat involved, but the paraspinal muscles are the muscles that run parallel to your spine are actually being addressed as well. And ultimately what happens is you allow those muscles to become symmetrical on both the right and left side. Okay, next exercise we're going to do is we're going to have Chris lying on his stomach. We're going to place a block between his feet. At home you could use some pillows, you could roll up a big beach towel into a tight ball. You're going to hold that block. You want to try to keep the whole inside borders of your feet in contact with the object. You're going to bend your knees up to 90 degrees. Now in that position you're going to squeeze and release the pillow. You're trying to squeeze with just the inside borders of your feet, and what that's going to do, it's going to activate the deep hip rotator muscles. And that's important because what I just described with the Ask Aaron is when you have an elevation in the pelvis, the muscles are typically weakened and tight, not shortened and tight. So what this is doing is we're trying to get a bilateral or a symmetrical contraction on both sides of the deeper glute muscles on each of the hips there. So you're going to squeeze and release 10 times. You can take a little break in between 10. And for a break, you're going to take as little as 5 or 10 seconds. If you're really fatigued, your glutes are on fire, take a little bit longer rest. And you're going to do a total of 3 sets there. So these two exercises, again, these aren't cure-alls, but they're really effective exercises to address these deviations. So I would do these exercises, and then even may want to do them in your chiropractor's office or your PT just to see if they make a difference so that your healthcare practitioner can take a look and see if those exercises aren't making a difference. So give it a shot, and stay tuned for part 3, which will that'll be the asymmetrical tilt in the pelvis. So we'll see you soon. Take care.